So hello, everyone, and welcome to our session today on e-cigarettes, vaping, electronic nicotine delivery system, or ENDS, and really what providers need to know in this space. My name is Taslim Van Hattem. I'm a Senior Director of Practice Improvement with the National Council for Behavioral Health, and I also have the really distinct pleasure of serving as the Director of the National Behavioral Health Network for Tobacco and Cancer Control. I'm thrilled to also welcome an incredible speaker who will join us today to talk about ENDS, Mitch Zellner, who's a director for the Center for Tobacco Products at the Food and Drug Administration. So again, I want to, welcome you on behalf of the National Council for Behavioral Health and the National Behavioral Health Network for Tobacco and Cancer Control. Today, we want to talk about a pretty wide variety of topics as it relates to ENDS, but most importantly, really helping you understand much of the disparity, the data, and the implications for vaping for adults and young people with behavioral health conditions, mental health, and substance use disorders. Talk about some of the long-term impacts of ENDS. And then, of course, really have Mitch explain to us some of the science and regulatory processes behind e-cigarettes, as well as be able to provide you, by the end of our session today, resources to effectively prevent and treat end usage, specifically with behavioral health populations. So I just want to start and ground us in a couple of really important pieces of information around why we know there currently is a really significant disparity around what I would say is commercial combustible cigarette smoking amongst adults with behavioral health conditions. And then we'll really, after laying that foundation, build upon it by talking about electronic nicotine delivery systems and the overall impact of tobacco use amongst adults with behavioral health conditions. So it's really important to know that much of the disparity around tobacco and behavioral health populations can be attributed to really significant predatory practices by tobacco companies. You'll see here everything from targeted advertisement to a lot of blocking of smoke-free policies in behavioral health facilities, and funding research that continues to perpetuate the myth that cessation is too stressful or really negatively impacts behavioral health outcomes. And hopefully throughout our time today, as well as in the future, we can really start to dispel some of those myths. And then I would be remiss if I didn't also say that much of the risk, as well as the disparity that we know exists with behavioral health populations, can also be attributed to the high rates of adverse childhood experiences, or ACEs, as well as trauma histories of individuals with behavioral health conditions. And then something I don't have to explain to many of you, of course, just the challenges that behavioral health populations continue to face as it relates to high quality care, everything from delays in care, lower quality of care, and additional barriers to care. So we also know that this has been a long history around commercial combustible tobacco, or what we might just refer to as cigarettes. But we also know that as we've moved into the last decade, that we continue to see the use of e-cigarettes and vaping. And we also know that many of those same tactics continue to play a role in how e-cigarettes and vaping, or ENDS, electronic nicotine delivery systems, are marketed to individuals with behavioral health conditions. The reason why this is so important, and I know my colleague from the FDA will go into this in a lot more detail, is of course the significant disparity, which is that individuals with behavioral health conditions account for almost 40% of all traditional cigarettes smoked by adults. But they also are significantly vulnerable to high e-cigarette use. And we know that individuals with behavioral health conditions are about twice as likely to have tried e-cigarettes, and are about 3 times as likely to be users of battery-powered ENDS, or electronic nicotine delivery systems. So I'm not going to go too deep into the details, because I know my colleague will be really framing that out for us. But I just want us to step into the content of this presentation today, knowing that we already have really significant disparities. And I don't have to explain that to many of you. You see clients every day in your clinics that have really high rates of tobacco use. But it's also really important to understand that we are seeing a significant vulnerability for high e-cigarette use. So this results in really high lifetime uses of ENDS with behavioral health populations. And then, of course, there's disparities as it relates to folks with different diagnoses. So really understanding that different diagnoses, everything from any mental health condition might put someone at a higher risk of exposure and use of ENDS, as well as then really looking at some additional risk as it relates to specific diagnoses. So with that in mind, and really just level setting as to what we know are some of the causes as it relates to targeted marketing, really high rates of adverse childhood experience, exposure and trauma, and then really significant gaps in access to care and quality of care. I also want us to think about what are some of those really important things that behavioral health providers need to know in order to really address ENDS use with their clients, as well as really know what are maybe some of the important pieces of information moving forward to prevent initiation and youth use, so that as we meet our clients in adulthood in many of the behavioral health settings that we might work in, we're able to provide prevention and intervention resources. So with that in mind, I'm going to turn it over to my colleague, Mitch Zellner, again, the director of tobacco, the director for the Center for Tobacco Products, excuse me, at the Food and Drug Administration Center for Tobacco Products. Mitch?
Thank you so much, Taslim. I'm going to try to share my screen now. Let's see if it works. Okay, so I'm going to sort of cover a lot of material in this talk. We've called the session Electronic Nicotine Delivery Systems, ENDS, and Youth Vaping, what you as providers need to know. But there's a lot that we need to talk about here in the next half hour or so. I want to start with some basic background on what FDA is and what our authorities are, kind of level set as to what e-cigarettes and other ENDS products are, talk a bit about what we're seeing as the magnitude of the health problem when it comes to kids. And all of that will be by way of background before highlighting for you the various programmatic actions that we have taken to deal with this issue. Then I'll move on to our public health concerns when it comes to kids and nicotine and adults with behavioral health issues and tobacco and nicotine and ENDS, before some closing thoughts on the wonderful partnership between FDA and the National Council. So let's dive in and start with some basic background on our authorities. We are implementing the Family Smoking Prevention and Tobacco Control Act, which became law in late June of 2009. I run the Center for Tobacco Products at FDA. We are the newest, and we are still the baby center at FDA, if you will, compared to the medical product centers that you may be more familiar with that have been around for many, many decades. And not only are we the newest, we are also different in the sense that we regulate products that are only inherently harmful. They have no benefit to society. The only question is relative to different types of tobacco products, are there relative risk considerations? But we were put into business under the Tobacco Control Act to reduce the harm from all regulated tobacco products. And what we are talking about here is the leading cause of completely preventable disease and death in the country and in the world. And while there has been comprehensive tobacco control efforts for many decades at the federal, state, and local level, it wasn't until passage of the Tobacco Control Act that product regulation had a seat at the table along with comprehensive tobacco control initiatives. The goals that we have, the public health mission, if you will, for the Center for Tobacco Products is to reduce the number of people who start using tobacco products, encourage more people who are using them to stop, and for those who continue to use tobacco products, to reduce the adverse health impacts. The original grant of authority in 2009, if you follow the cursor, was over cigarettes, cigarette tobacco, roll your own tobacco, and smokeless tobacco. That's what we started regulating. But there was this odd word in the law called deem, where Congress gave FDA the authority to deem other products that met the statutory definition of a tobacco product, as long as we did it through the rulemaking process, to be within our regulatory reach. And so if you've heard the term the deeming regulation or the final deeming rule, that's how we got regulatory authority over ENDS and all the other products that you see listed here. We started a rulemaking in 2014, we completed it in 2016, and it began to go into effect in the summer of 2016. And it seems to some counterintuitive that we are regulating things like e-cigarettes as tobacco products if they don't have any tobacco in them. But the key here is that statutory definition, which is anything that is made or derived from tobacco. And for the most part, the nicotine in e-cigarettes is derived from tobacco, and that's how we have the ability to regulate them as tobacco products. In general, we are regulating tobacco products under a broad population level public health standard. This is not the traditional safety and efficacy standard for medical products. And by law, this means that we have to take into account the impacts on users or non-users, or if you will, impact on initiation and impact on cessation. And what many of our decisions come down to, even though the law doesn't put it this way, is to identify and understand the net population level public health impacts of tobacco product use. Because not all of the impacts are going to be negative, and for sure not all of the impacts are going to be positive. So we have to carefully assess impact on users and non-users, impact on initiation and cessation. Because we're talking about inherently harmful products, when we do authorize a product for marketing, we don't talk about approving them. We don't approve tobacco products. We talk about authorizing them for marketing under whatever the legal standard is. Here you see the various pre-market pathways that we have. Not going to spend much time on that in this talk. Very broadly, because the law is a long and complex and complicated statute, these are the authorities that we have. The authority to review new products on a pre-market basis, to do post-market surveillance, to use something called the Product Standard Authority, which gives us the power to ban or limit the allowable level of any ingredient, compound, constituent, or additive in the finished tobacco product, mandatory testing and reporting, mandatory reporting of harmful and potentially harmful constituents, an adverse event reporting system, the power to require new warning labels on packages, labeling, and advertising, the ability consistent with the First Amendment to impose restrictions on advertising and promotion. And we are entirely funded by industry paid user fees, and that's all specified in the law. There are no direct congressional appropriations or taxpayer dollars. By law, Congress has said what our budget is supposed to be each year, and industry pays. So let's turn to e-cigarettes and other ENDS products and ask the fundamental question of, what are we talking about here? And the field came up with this broad term of electronic nicotine delivery systems to capture what is really the heterogeneity of these products. There's no one product. That could be a vape, an e-cigarette, an e-cigar, an e-hookah, even an e-pipe. The one thing that these products generally have in common is that they heat an e-liquid. That e-liquid usually contains nicotine. And when the liquid gets heated to a high enough temperature, it aerosolizes and a vapor is inhaled by the user. And again, there's variation here, but that in any given product, the user may be inhaling different types of flavorings, different types of carriers for the nicotine in the flavors, whether it's propylene glycol or vegetable glycerin and other ingredients. These products come in a wide variety of shapes and designs, and I'll show you a picture in just a second to capture that heterogeneity. When it comes to kids and experimentation with e-cigarettes, we have a number of concerns. In the fourth or fifth generation of products that have been put onto the market, we are all seeing products that closely resemble USB flash drives that can have very, very high levels of nicotine and emissions that are hard to see. All of these are characteristics that make these products particularly appealing to kids. So experimentation is rampant, and remarkably surveys show that there's a sizable percentage, albeit a minority of kids, who don't even know that there's nicotine in e-cigarettes. So here's, and this picture is actually a couple years old, but here's the representative example of the many shapes and sizes, including an e-pipe, that these electronic nicotine delivery systems can come in the marketplace. So what's the nature of the problem that we're talking about when it comes to kids' use of e-cigarettes? This is data from the 2020 National Youth Tobacco Survey, and I'll start with the good news. From 2019 to 2020, there was a decline, a significant decline. 1.8 million fewer middle school and high school kids being current e-cigarette users in 2020 compared to 2019. That's the good news. The bad news is that took us back basically to the 2018 level. And in 2018, we declared this to be an epidemic. So we were very happy to see a significant decline last year, and we hope that that decline continues this year. But we are still dealing with epidemic levels of kids' use of e-cigarettes. And we are particularly concerned about the popularity of flavored e-cigarettes with kids. Amongst current e-cigarette users, 12 to 17-year-olds, 8 out of 10 use a flavored product. We are also extremely concerned about frequent use. And the researchers define frequent use as vaping on 20 or more of the past 30 days. Last year, frequent use went up to almost 40%, up from 34.2% in 2019. And more than half of those frequent vapors actually vaped on every single day of the past 30 days. And sadly, frequent use, and especially daily use, is putting a kid on the pathway to nicotine addiction. So what's FDA doing about it? Well, let me start with pre-market review of these products. Under the terms of a court order, applications for all of the ENDS products currently on the market, along with those other products that you saw listed on that earlier slide, had to be submitted to us by September 9th of last year. When that court order came out in 2019, not knowing what the bolus of applications was going to be, we started saying publicly, we're going to be flooded with applications, and the likelihood that we're going to complete scientific review of all these applications is low. Well, we wound up getting thousands of applications for millions of products. And scientific review has begun for the applications that we can start reviewing. Under the terms of that court order, if products were the subject of timely submitted applications, they can remain on the market for a maximum of 1 year while we are reviewing their application, unless we take an enforcement action or issue a negative order before then. To date, there isn't a single ENDS product that has received a marketing authorization, and technically all of these products are on the market illegally. When we got jurisdiction back in 2016, obviously there were many thousands of products already on the market then, and they got to remain on the market through an exercise of what we call enforcement discretion. Since these are illegally marketed products, we have had enforcement priorities in place for a number of years. And here are those enforcement priorities, starting with any flavored cartridge or pod-based product other than tobacco or menthol flavoring. Any of these products, regardless of flavor, regardless of form, if there's evidence that the manufacturer has failed to take or is failing to take the right measures to prevent youth access. Any product, again, regardless of flavor or form, if we have evidence that the product is being targeted or marketed to kids. Any product that continues to be sold for which we didn't get an application. And then on the basis of the 2020 NYTS data, flavored disposable ends products are an enforcement priority. And let's just say that over the last couple of years, we have been very busy having to take enforcement action, starting with what we call warning letters against ends products. I'm going to give you some examples. And if you haven't seen these are stunning. These are literally a backpack and a hoodie or a sweatshirt purposely designed with stealth pockets to conceal the use of a vaping device. E-liquids purposely designed to imitate kid-appealing candy and other food products. Ends products purposely designed to resemble smartwatches, toys, or other devices that are popular with kids. I mean, ask yourself, which one of these is an ends product and which one of these is the smartwatch if we didn't have the words there on the bottom? All of these products have been on the receiving end of enforcement action by FDA. We've also been busy in general when it comes to unauthorized sale of the products that are enforcement priorities. Since March of last year, we've sent over 260 warning letters to online and brick and mortar manufacturers and retailers for the unauthorized sale of those flavored cartridge-based products. And that unfortunately has included warning letters to national chains like 7-Eleven and Shell. And more recently, since just mid-January of this year, we have issued warning letters to 92 companies that collectively have listed over 794,000 products with us because we had evidence those products were on the market and there were no applications filed with FDA. Let me turn to our public education efforts. We launched the Real Cost cigarette prevention campaign in 2014, and in 2018, with the epidemic of kids' use of e-cigarettes, we took our branded campaign and launched the Real Cost Youth E-Cigarette Prevention Campaign. These are hard-hitting messages focused on reversing the misperceptions that kids have that e-cigarettes are harmless, explaining to them in hard-hitting ways that e-cigarettes, just like cigarettes, put them at risk of addiction and other health consequences. And our ads are running everywhere, on TV, online. Pre-pandemic, we were doing location-targeted advertising around high schools. And in consultation and partnership with Scholastic and Students Against Destructive Decisions, we put posters into the bathrooms of every public and private high school in the country. Last year, we launched a new video series that we called My Vaping Mistake. These are actual kids who started vaping and ran into trouble. And they look directly into the camera and tell the true stories of the physical and the emotional effects of e-cigarette addiction and what they went through. These were a series that were released on youth-focused channels and then amplified on our social media. Each of these spots ends with a call to action to drive teens who are concerned about their e-cigarette use to the How to Quit Vaping page at the National Cancer Institute. I mentioned Scholastic. We have this wonderful partnership with Scholastic where we have developed and co-branded all kinds of educational materials for teachers and administrators, examples of which you see here, lesson plans, infographics, etc. And we have something called the CTP Exchange Lab, and the URL is here where anyone can go to our Exchange Lab and download for free all kinds of materials, print, web, social media, messaging on the harms of vaping, the harms of cigarette use, who we are, what we do, basic tobacco control research. Let's now turn to the public health concerns, first for kids and then for adults. And for kids, the concerns about nicotine and tobacco use. You all know this. The brain is still developing in adolescence. Our brains are not fully formed until we are in our mid-20s. So any exposure to the adolescent brain of nicotine is a concern. And there can be effects. Increased impulsivity and mood disorders, impacts on the parts of the brain that are responsible for addiction and learning and memory, impact on brain functions for reward processing, which can make it easier for kids to become addicted to nicotine. This is not a discussion about harm reduction. This is not a discussion about the relative risk and the possible benefit of e-cigarettes for addicted adult cigarette smokers. No kid should be initiating on any nicotine-containing tobacco product. And sadly, from a public education perspective, we start behind the 8 ball with kids. When we do our cigarette prevention efforts, we are reaching a target audience that already knows that cigarettes are incredibly dangerous. We're trying to reach them in new and creative ways to get them to rethink their relationship with cigarettes. We start further behind with kids and e-cigarettes because too many kids are walking around thinking that e-cigarettes are harmless. And as I said before, some kids aren't even aware that nicotine is present. I shared that data from the 2020 NYTS on frequent use. We are very concerned about addiction to teens, and there are no FDA-approved pharmacotherapies for anybody under the age of 18. And so in 2019, we convened 2 separate public meetings to address the issue of youth cessation, to figure out what can and should be done, not just by FDA, but by pharmaceutical industry researchers in the field. Because as I said, we have no FDA-approved pharmacotherapy for kids who are addicted. We have launched some important teen cessation content with NCI on their smoke-free teen website. And since we launched this almost 2 years ago, there have been over 6 million page views. And we're happy to see where people who are going to Smoke-Free Teen are spending most of their time on pages devoted to how to quit smoking, tips for managing stress and anxiety, and how to manage withdrawal. So let's turn to adults. And let's start with ends and harm reduction and relative risk and cessation. We commissioned a report of the National Academies that came out in 2018, where an expert NASEM panel concluded that there was substantial evidence that, except for nicotine, exposure to really harmful substances from e-cigarettes is significantly lower than when compared to what's in tobacco smoke or cigarette smoke. But importantly, the report concluded that the only potential benefit comes from completely switching from combustible cigarettes to e-cigarettes. Otherwise, there is no harm reduction opportunity. As for cessation, there was an important Cochrane review that came out last year, which found, with some limitations that I am going to describe because the limitations are important, that ENDS products may help more people to stop smoking for 6 months or longer compared to NRT or nicotine-free e-cigarettes. ENDS may increase quit rates compared to just behavioral support or no support, and that the overall incidence of serious adverse effects from ENDS is low. But the Cochrane review concluded that there is still insufficient evidence about the overall effects of e-cigarettes, especially with the newer generation of products that euphemistically are doing a better job of nicotine delivery. The way I would put it is the pharmacokinetic profile of these newer products, which may actually be of value for cigarette smokers who completely switch, is one of the concerns we have with kids who initiate on these products. As I said, there were important limitations that came with the Cochrane review. Fewer than half the studies were done in the United States. Not all of the enrolled persons in the studies were trying to quit. Assessment of quitting varied from study to study. Not all the studies reported adverse effects. Only about half of the studies were RCTs, and the Cochrane authors concluded that 37 of the 50 studies were judged to be at high risk of bias. So let's turn to tobacco and behavioral health. Taz mentioned this earlier. For individuals with behavioral health conditions like depression and anxiety, we're talking about that accounts for 40% of the use of traditional cigarettes. This is a significantly vulnerable group for ongoing cigarette use and for high e-cigarette use. And when it comes to the overall progress that has been made in reducing consumption and prevalence of combustible cigarettes, say going back to the first Surgeon General's report in 1964, those population level numbers mask what's going on at a subpopulation level, and especially for those with substance abuse and mental health comorbidities. As for e-cigarettes, as you heard, the studies have shown that those with behavioral health conditions are twice as likely to have tried an e-cigarette and 3 times as likely to be users of some other type of battery-powered ENDS product. Now, it's a mixed bag here because, again, if an addicted cigarette smoker is completely switching to e-cigarettes, there could be some potential public health benefit there because they would be significantly reducing their exposure to toxins. However, individuals with mental illness are often what we call dual users, combining e-cigarettes with concurrent use of combustible products. And that makes them more at risk for nicotine addiction and susceptible to all the ongoing chronic effects of traditional tobacco products. So what are the implications for clinicians and everybody in the field? Well, point 1, not a single ENDS product has been approved by FDA as a cessation aid. Yes, we are aware of anecdotal evidence, and I personally find some of this anecdotal evidence compelling that e-cigarettes have helped some smokers quit. I actually believe some of those anecdotal reports, but we can't make policy on the basis of purely anecdotal evidence. And what I come back to is, yeah, there certainly are people out there who manage to get off of cigarettes because of e-cigarettes, but there's a far higher percentage of current e-cigarette users in all populations that continue to smoke cigarettes. So based upon the current evidence, any health benefit when it comes to e-cigarettes will only happen if a smoker completely quits smoking. And we have a lot of work to do there. We will continue to study, all of us, the short, medium, and especially long-term health effects of ENDS. They've been around for such a short period of time that we don't know what the long-term effects are. We can't lose sight of what we do know about the ongoing harms from cigarette smoking, and that being a current or former cigarette smoker makes you more likely to get severely ill if you contract COVID. Here's what we can say to patients. If they're concerned about their health and interested in quitting, start with the FDA-approved smoking cessation products, whether it's prescription or over-the-counter nicotine replacement therapies, prescription medicines without nicotine, or a recent device, the first ever device that we have authorized as a smoking cessation aid that uses deep transcranial magnetic stimulation. There are some special considerations for smokers with behavioral health conditions. They may be addicted to higher levels of nicotine. It may be harder for them to quit, and they may need more intensive treatment. So what can be done? Well, we know that combining counseling with pharmacotherapy can increase the likelihood of a successful quit. We know that combination NRT therapy can increase efficacy. It's a combination of patch and any of the oral forms. So the patch is on for chronic exposure, delivery of nicotine, and the oral forms for acute. Prolonged use of NRT can be helpful to certain patients. And for bupropion, it's approved for use with OTC NRT. Let me close by talking about the wonderful partnership that we have with NCBH. Working together, everybody in the field, great progress at a population level in lowering smoking rates. I mean, that's the good news. But as I've said, who's been left behind? Who is the remaining smoker? The remaining smoker is far more likely to be someone with a substance abuse or mental health comorbidity. And at a population level, they have been left out of the conversation. Kids remain a vulnerable population. Yeah, we had a good year in reducing kids' use of e-cigarettes, but we still have 3.6 million kids who are using e-cigarettes. This is a challenge. Whether it's a gateway to cigarettes or not, we've discussed any exposure to the adolescent brain from nicotine is a concern. In 2019, we and NCBH signed an agreement to solidify the partnership that we have. And we will work together to try to reach the mutual goals of educating kids and families about the dangers of the use of any tobacco product. We will work to raise awareness and meet the challenge of reducing tobacco use amongst all populations. And I'm optimistic. We have historically low cigarette smoking rates at a population level. And we have 1 year in our pockets of finally reducing kids' use of e-cigarettes. Got a lot of work to do, and it's especially hard with vulnerable populations. But I'm going to be optimistic that in government, out of government, policy, research, treatment, advocacy, working with the media, that we can do more to address what remains, as I said, the leading cause of completely preventable disease and death in the country. So I'd like to thank you for all of your efforts in addressing this important issue as we move forward. And I'll close with a slide that tells you how you can contact us by phone, by email, how you can follow us on Twitter. And I'll put in a shameless plug for the FDA virtual exhibit booth at NatCon21. Thank you very, very much for your time. And I will now send it back to Tess.
Great. Well, thank you so much, Mitch. As you, it was so helpful for me to hear you actually just walk through so much of the behind the scenes pieces around electronic nicotine delivery systems, and just, provide the information for folks in the field. And I think that's incredibly important for all of us, particularly, let me just get these up, thanks. As we know that rate of cigarette or tobacco use in behavioral health populations is twice that of the general population, and that disparity continues to be so large and overwhelming. And I don't have to explain that to most folks on the line, right? Like any of us that have been on a clinic floor know that tobacco and ENDS use is a problem and continues to be a problem with your clients. But I think that, of course, what was so helpful today is to hear so much about what are some of the regulatory processes, what are the actual products, and then some really important considerations for clinicians. And I think, really grounding in the fact that so many of the interventions and the tools that clinicians can have are, of course, many of the evidence-based interventions that folks are already very familiar with, right? Passing and including ENDS in really strong policies around tobacco-free campuses or facilities in behavioral health settings, really looking at integrating strong tobacco treatment into your protocols, everything from screening and counseling to the provision of NRTs and other pharmacological supports as really strong cessation aids, engaging peers and peer recovery specialists in our work. If nothing else, of course, always knowing that every client that comes, excuse me, can also leave with a referral to a quit line that we have in every state across the country. And then, of course, what I want every clinician to leave today knowing is that the National Council for Behavioral Health, in partnership with the FDA, is also just incredibly committed to our work around addressing the disparity of tobacco use in behavioral health populations, and committed to doing that and providing you with the tools and technical assistance needed through the National Behavioral Health Network for Tobacco and Cancer Control at an organizational level, at a clinician level, and then ultimately at a client level. And so we do that in a couple of different ways through really generous funding through the CDC's Office of Smoking and Health and Division of Cancer Prevention and Control, but really developing out customized training and technical assistance for behavioral health providers, both, again, as I said, at that really organizational level, then really thinking about how to train and empower staff, and then how that filters down to each and every one of your clients that you might be seeing. So do not be afraid to reach out and ask us at the National Council for Behavioral Health for additional support. I'll also drop in the chat box access to our most recently released toolkit, which is really around addressing health disparities related to tobacco use amongst behavioral health populations. And we really have developed this so that on the one hand, it's really targeted towards a lot of statewide tobacco control programs, but within it, we've also done a compendium of every single toolkit that currently exists for behavioral health providers to really look at how to integrate many of those evidence-based interventions into your practice, as well as start really expanding much of your organizational and clinician level and client level training, technical assistance, and just information around electronic nicotine delivery systems. So we're so thankful to the FDA and to Mitch for sharing such incredible information to ground us in what are electronic nicotine delivery systems and what are some of the ways to start addressing them in behavioral health settings. And then we're also so thankful for the partnership with the FDA moving forward to know that we can provide you with additional training and technical assistance offerings well beyond this presentation today. So thank you so much and have a wonderful day.